Most doctors agree we are eating too much salt and it is affecting our health. And yet, when it comes to seasoning our food, we can't have enough of it. What's the truth about salt and health? Can you live without salt, or do we have to? Hi, I'm Dr. Radha, and I'm here to talk about everyone's favorite seasoning and how to stop it from killing you. Sodium is an essential mineral for health, most commonly available as sodium chloride or salt. It is important for nerve and muscle activity and to maintain the correct balance between fluid and minerals in our body. We need around 500 milligrams of sodium, or just 1.27 grams of sodium chloride or salt, to maintain our health. But we consume way more what is required or is healthy. According to a recent study in the Journal of Hypertension, average salt consumption in India is nearly 11 grams per day, which is more than twice the recommended WHO limit of 5 grams per day. Salt consumption is higher in southern and eastern states, with Tripura having an average intake of 14 grams per day. But why should any of this matter? The key is the link between salt intake and hypertension, which is the chief cause of heart disease and stroke and mortality in India. Excess sodium intake can also worsen kidney disease and increase protein excretion in urine. It can cause kidney stones and is also linked to osteoporosis and gastric cancer. In 2016, hypertension killed nearly 1.63 million Indians. It's responsible for nearly 50% of all heart attacks and strokes. According to the 4th district level household survey, hypertension affects nearly a quarter of all Indians above the age group of 18. This means nearly 207 million Indian adults are hypertensive. What is more alarming is that 1 out of 10 between the age groups of 18 and 25 have high blood pressure, and the trend is increasing. There is strong evidence from population studies, genetic studies, animal studies with salt-sensitive and salt-resistant dal rats, migration studies, ecological studies, longitudinal observational studies, clinical trials, and meta-analysis of trials that dietary sodium intake gives rise to primary hypertension, which is the most common form. Conversely, reducing salt intake can prevent hypertension, reduce blood pressure in those with the disease, and lessen the need for blood pressure medication. One study showed that cutting salt intake by just 3 grams could prevent nearly 50% of the deaths. The dietary approaches to stop hypertension, DASH diet, the sodium trial tested the effects of 3 different levels of sodium intake in 2 types of diets. It found a progressive decrease in blood pressure with lowering of dietary sodium, and the effect was greatest in older individuals. So, There is robust evidence that lowering dietary sodium has health benefits, and a low sodium diet is not just for patients but a recommended healthy lifestyle for everybody. The WHO recommends we have less than 2 grams of sodium or 5 grams of sodium chloride or salt daily, which is around a teaspoon of salt. The American Heart Association went further and set 1500 milligrams per day of sodium or 3.8 grams of salt, which is 3/4 of a teaspoon, as recommended upper limit of intake. But that's easier said than done. Salt is ubiquitous in our daily life. In fast food, pickles and curries, everything has salt. Even food not associated with salt like bread and sweet biscuits contain added salt. And those who drastically cut down their salt intake often report feeling weak and tired. The good news is that the sensitivity of our palates adjusts over a period of time. So it's possible to enjoy your food with lowered salt contents. Cut down on processed foods as these have the most salt content. If you add salt towards the end of cooking or at the table, you will need less to achieve the same flavor. Try using fresh herbs, spices and lemon, ginger, garlic and chilies to enhance the flavor of food rather than using excess salt. A word on so-called low sodium salt and other products marketed as healthy salts. Some manufacturers add small amounts of potassium chloride to salt, and this is probably healthier as potassium can lower blood pressure. But keep in mind that most of the salt is still sodium and still you need to control intake. And potassium may not be safe for those with kidney disease, nor is it safe while using some of the medications. Other salts like Himalayan pink salt are marketed with buzzwords like natural, unpolluted, pure and ancient, with all sorts of purported health benefits. But there is no peer-reviewed data to suggest it is healthier than regular table salt. Thank you.